PA Medi Medicare Counseling welcomes you to our virtual presentation. I am Elaine Munzer, a volunteer counselor, and I am joined today by Lorraine Williams, who is also a volunteer counselor. What is PA Medi? PA Medi is the name for Pennsylvania's State Health Insurance Assistance Program, known as a SHIP. SHIPs are available in every state. PA Medi offers free health benefits counseling to Medicare beneficiaries and their families or caregivers. Our mission is to educate, advocate, counsel, and empower people to make informed Medicare benefits decisions. PA Medi is an independent program funded by federal agencies and is not affiliated with the insurance industry. PA Medi staff and volunteer counselors are certified by the Pennsylvania Department of Aging and are highly trained and well qualified to help you as a Medicare beneficiary understand your health care coverage options. All information gathered is strictly confidential. PA Medi counselors provide free, unbiased Medicare counseling services, which are personalized to your individual medical insurance needs. The PA Medi program also focuses on community education and outreach. We provide screening for financially based eligibility programs, including the Pennsylvania PACE and PACENet, the federal Extra Help, also known as Low Income Subsidy, and Medicare savings programs to help with Part B costs. The Bucks County PA Medi program currently has approximately 20 Medicare volunteers. Counseling sessions are provided throughout the year, with additional sessions during the annual open enrollment period from October 15th through December 7th. Counseling usually takes place at public locations throughout Bucks County, such as senior centers and libraries. However, during COVID-19, all counseling is done by phone or with limited in-person sessions. Please contact Bucks County PA Medi at 267-880-5700 for information on our counseling and on our volunteer opportunities.
Thank you, Elaine. Now we'll discuss Medicare Parts A and B. How and when do you enroll in Medicare? Well, you're eligible on your 65th birthday or the 25th month of disability. Social Security automatically sends Medicare cards to those eligible if you're receiving Social Security or railroad retirement, Social Security disability, again, eligible on the 25th month of your disability, or if you're receiving SSI, known as Supplemental Security Income. If you are not receiving the benefits I just spoke of, you can apply at the Social Security Administration by phone, mail, or online. The 3 months before your 65th birthday, at which time you would receive benefits on your birthday month, or if you apply on the 65th birthday month, you would receive the benefit the next month. Or you have the 3 months after your 65th birthday, you can sign up, but you would have significant delay in coverage. Let's talk about Medicare and your employer coverage. Are Part A and Part B needed? There are tax implications if you enroll in Medicare while contributing to a health savings account known as an HSA. It is recommended to stop HSA contributions 6 months prior to enrolling in any part of Medicare. If you are covered by creditable active employer insurance, you do not need to enroll into Part B. When active employer coverage ends, you receive a special enrollment period for Part B without penalty. You must enroll in Part A and Part B if your employer has less than 20 employees. Part A and Part B coverage is known as, Part A coverage is known as hospital coverage. There is a deductible of $1,556 for each hospital benefit period. It includes short-term skilled nursing facility stays, limited skilled nursing home health care, and hospice care. Part B coverage is referenced as medical insurance. Medicare pays 80% of outpatient medical coverage. There is a $233 annual deductible. This includes doctor and visits, medically necessary tests, durable medical equipment, and preventive services. Okay, how much does Parts A and B cost? The Part A premium is based on employment history. If you or your spouse worked 40 quarters, which would equal 10 years or more, it is free and paid through payroll taxes. The Part B premium is $170.10 per month. It must be paid in order to receive original Medicare, a Medicare supplement, or a Medicare Advantage plan. It may be paid by the state if you meet financial eligibility criteria. They are known as Medicare savings programs. It may cost more if you have a higher income level, and you may have heard of the term IRMA. What are your Medicare options? They are Medicare supplements or Medicare Advantage plans. The first option, Medicare supplements, again, also known as Medigap plans, cover Part A and Part B copays, coinsurance, and deductibles. Part B deductible is not covered except if you are grandfathered into plans C and F. It is provided by private insurance companies. Monthly premiums vary by company. Plan types are standardized by federal regulations, and you can only be dropped from a plan for failure to pay the premium. How are you to enroll in Medigap? The PA Medi program can assist in explaining coverage according to plan letter, providing company names and phone numbers, and providing cost estimates through CSG actuarial data systems. Or you can contact the private insurance companies or Medicare brokers directly. Elaine will now discuss the other option.
Part C Medicare Advantage plans. What are Part C Medicare Advantage plans? This is a method of choosing your Medicare insurance through private insurance companies. You will still have Medicare, Parts A and B. You will have a plan-specific localized network of providers to use. The plan will usually have fees associated with most services, out-of-pocket costs for copays, coinsurance, and deductibles. Medicare Advantage plans are required to cover the same services as original Medicare. So they include Part A, Part B, and most cover Part D prescription drug coverage. Many offer additional vision, dental, and hearing services if you stay in their network. You can choose from several different types of managed care structures. HMOs are health maintenance organizations, which usually have a local-only network. PPOs are preferred provider organizations, which may have out-of-network benefits at a greater out-of-pocket cost to you. You may enroll in a Medicare Advantage Part C plan on Medicare.gov website with assistance from the PA Medi program counselors or through a private insurance company or Medicare broker. You are able to change your Medicare Advantage plan each year during the annual open enrollment period from October 15th through December 7th, with the new plan starting in January 1st of the following year. What does Part C Medicare Advantage cost? The costs vary, sometimes greatly, by individual plan. Most costs will involve deductibles, copays, and/or coinsurances. Your monthly premiums may be as low as $0 per month. And again, most include drug coverage and extras such as dental, vision, and hearing. Please be aware that you cannot be enrolled in both a Part C Medicare Advantage plan and a Medicare Medigap supplement plan. An option to use with your original Medicare Part A and B is a Medigap supplement plan. You can use a Medigap supplement plan with any provider anywhere in the country who accepts Medicare. You will then have no copays, coinsurance, or deductibles, with the exception of the annual Part B deductible, which for 2022 is $233, or with some copays with end plan options. With a Medigap supplement, no referrals or authorizations for services are needed. Your coverage is standard by plan letter A through N. You may have underwriting, which means medical history, if you want to switch a plan, and you can be rejected for pre-existing medical conditions if you are out of your Medigap open enrollment period. A Part D prescription drug plan must be purchased separately, and you can switch your drug plan each year during annual open enrollment. If you have a Medigap supplement plan, you can only be dropped for failure to pay the premium. Instead of original Medicare, you can choose to receive your benefits through a Part C Medicare Advantage plan. Again, these are the HMO and PPOs plans sold by private insurance companies. The plans are usually localized and will have an assigned network of providers. Most Medicare Advantage plans also include your Part D drug plan. Your monthly premium may be much less than paying premiums for both a Medigap supplement and a separate Part D plan. Some Medicare Advantage plans have a $0 premium. Again, you will have copays, deductibles, and coinsurances for most services. And the benefits and provider networks vary from plan to plan. With a Medicare Advantage plan, you can change plans yearly during the annual open enrollment period. You may get extra benefits such as hearing, dental, and vision within network, and sometimes at an extra cost if out of network. Not all doctors, hospitals, or providers accept all Medicare Advantage plans. A Medicare Advantage plan will have a maximum out-of-pocket cost, which for 2022 can be $7,550, after which the plan will pay for your covered Part A and B services. What is Part D? Part D is prescription drug coverage provided through either a freestanding Part D plan known as a PDP or with your Medicare Advantage plan. You will need a Part D plan with a Medigap plan or original Medicare. You will have a monthly penalty if you sign up late for having no Part D plan. Part D plans have specific drug formularies that are covered, and they help with the cost of prescription drugs. Your Part D freestanding plan will have a separate monthly premium, copays, and deductibles for your drugs. Most Medicare Advantage plans, the Part C managed care, include prescription drug coverage within the plan. When should you enroll in a Part D? You can enroll in a Part D drug plan during your initial enrollment period, again, based around your 65th birthday or your 25th month of Social Security disability. or during a special enrollment period, such as having had coverage from an employer, or during the annual open enrollment period from October 15th through December 7th. Please note, you may incur a lifetime penalty if you do not enroll during your initial enrollment or special enrollment period. And you may change your plan for Part D yearly during the annual open enrollment period. There are programs to help with your prescription drug costs. The Extra Help or Low Income Subsidy Program is a federal program that helps Medicare beneficiaries dramatically lower their prescription drug costs. You may be eligible for extra help if you meet financial income and asset limits, or if you receive Medicare Savings Program help for Part B premium assistance. The state of Pennsylvania has its own program called PACE and PaceNet for prescription drug help. To qualify for Pennsylvania's program, you must be 65 years of age or older, a resident of Pennsylvania for at least 90 days, not receiving your prescription drug benefits under medical assistance or Medicaid, and you must meet the PACE and PaceNet income guidelines. Please be aware that there are no asset limits as there are with the federal programs. So please inquire as to your eligibility for the Pennsylvania PACE or PaceNet programs. And now I'm turning it back over to Lorraine to do a review.
Thanks, Elaine. So we're going to review your Medicare options. You can choose either of the following options. On the left, you'll see Original Medicare, which you'll receive a red, white, and blue card, and that covers Part A, hospital insurance, and Part B, medical insurance. Then you would add your prescription drug plan, which is known as Part D. Plus, you have the option of purchasing Medigap policies. They are known as plans A through N, or if you have retiree, Medicaid, TRICARE, or Veterans Administration coverage. You would present, again, your Medicare card at the doctor's office. Or you can go with Medicare Advantage plans, as Elaine said, Part C, and they are your HMOs and PPOs. You will use the insurance company's card that they issue to you for your coverage. It includes Part A, hospital, Part B, medical, and it includes Part D, drug plan prescriptions. So Part C is provided by private insurance companies that are approved by Medicare. You must use the plan's network doctors and hospitals, or you will pay more. Some plans charge a monthly premium. You will likely pay deductibles, co-payments, and or co-insurances for covered services. You must use the Part C drug coverage. Feel free to contact the following for resource information. You can call the Bucks County PA Medi for information and or an individual counseling appointment at 267-880-5700. Or you can contact Medicare at 1-800-633-4227. Or you can go online at www.medicare.gov. Or you can contact the Social Security Administration for Part A and Part B enrollment by calling 800-772-1213 or online at www.ssa.gov. For PA Medi assistance, if you have a question or you want to schedule an appointment or ask for information about joining our volunteer team, call Bucks County PA Medi today, 267-880-5700. We're located at 55 East Court Street on the 3rd floor. And we can also be found online at www.buckscounty.com medicare.gov/PA Medi. Thank you for taking time to learn more about Medicare.